we went with the MMI back in 2012, and we've been using it, and I don't think that we will ever go back to the traditional interviews. We really, from my perspective as chair of the admissions committee, we're finally getting what we want
Really?
out of interviews. You know, we would get kind of superficial evaluations in some cases from our interviewers, you know, that said, you know, student went to X, Y, and Z college. They received a 3.8 on their GPA. They received,
But you already knew that.
yeah, a 525 on their MCAT. They're going to be a great doctor. And, you know, you'd sometimes think, if it were that easy, why are we doing interviews?
Right.
You know, so really now it's forcing more of the non-cognitive stuff, more of the interpersonal skills, the competencies, the resilience, you know, curiosity, communication skills, you know, written communication, empathy, all of those types of things. We're really able to, I think, assess that in a different way using the MMI. So I think that, you know, tips for students really would be to become comfortable with themselves, comfortable meeting new people, shaking hands, looking people in the eye when you talk to them. You don't have to be an expert on health policy or, you know, insurance or anything like that. We're not looking for that. I'm not looking for students to diagnose patients. But I am looking that they have had experiences working with patients, interacting with physicians, being a leader, maybe being a mentor, a teacher, something like that, serving diverse populations. So each of our questions is really geared towards something like that and part of the competencies from the AAMC.
Your comments, I think, were very helpful in terms of telling me or a listener what you're looking for in the MMI. But is there a way to prep for the MMI?
Yeah, so our MMI, I think, is different from other schools in the sense that we don't do a lot of scenario based. A lot of our questions are really traditional questions.
Oh, all right.
I think that, you know, some of them are scenario based, and those are the questions that are given more to admissions committee members or physicians. But again, we're not looking to have a student diagnose patients or prescribe medication, but essentially be able to articulate what a doc does during the day and how they interact with their patients. And, you know, ethical scenarios may come up in our MMI. So I think really being true to yourself, being comfortable with how you interact with others is really going to be very important. So I think really just practicing the interview itself. I think that students that aren't successful in our MMI are not comfortable with themselves, or are not comfortable with meeting new people, or are not comfortable talking about themselves. And I think that that is really somewhere that they struggle. And so putting themselves, and I tell students this all the time, I want you to practice interviews, and I want you to practice being comfortably uncomfortable, because nobody's comfortable in this kind of a situation, right?
Right.
They're not comfortable meeting all of these new people and being evaluated, but if you stop thinking about that and you just are yourself, and you have practiced, you know, walking in, looking someone in the eye, saying it's nice to meet you, shaking their hand, and sitting down and answering the question, that's what we're looking for.
Right.
That's what you're going to be doing as a physician.
Of course.
So,
it makes sense. Makes sense. So the MMI at SUNY is more like multiple, if you will, traditional interviews. It's not scenario based, as you say. There's not going to be an actor.
there's not there is a standardized patient.
Oh, all right. Okay.
One standardized patient, and then there's also some scenarios, but it's more, without giving too much away,
Okay.
it's really more ethical based. You know, if in this situation, what would you do?
All right. And then, but there are multiple people that they're talking to. That's the other part of it.
Yep. There are 9 different stations per applicant.
And does any of the stations give the applicant, let's say, more traditional interview questions, you know, walk me through your resume, or why did you do X, Y, and Z, or why do you want to be
Yeah.
a doctor?
So again, without giving out too much,
Okay, okay,
they need to know that they're interviewing at Upstate. So I'll
okay.
say,
All right.
um, they need to be able to um, talk about the reasons why. They need to be able to answer ethical questions. They need to be able to provide written communication,
Okay.
and they should know if there are any, let me just say, red flags or any concerns in their application, that there will be either an opportunity in the MMIs or an opportunity to meet with me to talk about those.